Hello, everyone. Thank you for joining me here at the Better Nutrition Program. I'm Ashley Koff, a registered dietitian, and this is like one of the absolute favorite things that I get to do at this phase of my career. So the Better Nutrition Expert Interview Series is designed to help you learn from experts that I've hand-selected on key topics where, why do we want to talk to experts? Well, there's a lot of science information out there, but our experts actually are science-based, but then they're also practice-based. So what we get is to talk to people who have spent their careers, and today we're talking to somebody who's been doing this for like 3 decades, even though she doesn't look it at all. But we're going to talk about the fact that, information changes, but for those of us that have been practicing over the decades, we actually know that there's a lot of stuff that stayed the same, and we also have the ability to help you navigate, along with some of the newer information, or in the case of new technologies. So if you're just watching us and you're watching live, please feel free to tell us where you're joining from, or share a question, or if you want to give us a thumbs up or a heart or any of that stuff. We love all that support. And if you are watching later, you still can get your questions answered. So when you post a question, I'll see it. I can tag it over to LaurieAnn, so we can make sure that we get an answer there. And if you're watching us on YouTube, we always love a thumbs up if you like what you see. And in any case, if you're able to share this information, the Better Nutrition Expert Interview Series is not financed. It's a nonprofit project. We're all just here sharing our time and our information. So we would love to just try to get that information out to more people, and that's our goal. So without further ado, LaurieAnn Scher is joining us today. She's got, as somebody just told me the other day, I thought it was so funny. She's got a whole alphabet soup after her name, and we're going to dive into what it means to have your master's and be a dietitian and be a certified diabetic educator. But she also has a master's in exercise physiology, so a lot of really robust information and expertise. So welcome. Thank you so much for joining us today.
Thank you so much for having me. I'm really excited to share everything.
Great. And one of the things I love, I always ask these pre-interview questions, and one of the things I love that you were saying is you've been doing this for 30 years, and you really had this opportunity. I think so many of us have seen, or we often will criticize maybe even the digital world as like intervening in our lives in a negative way, but you're identifying that it's been a positive way for you to reach more people. And so share a little bit about sort of that move from working one-on-one to moving into a digital platform.
Yeah, so that was a really exciting thing for me, to be able to reach more people. So when I was working in practice, and I would, sit at my desk, or if I was lucky enough, I could go out for a walk with, a patient or something like that. And I was able to see, maybe 8 to 12 people a day. And then being able to reach them digitally on our app, I can reach thousands of people every day, and I can reach them globally. So we have people who use our app that are in India or Nepal or Staten Island.
Yeah.
So we're really lucky that we, that this digital piece has allowed me to reach people and educate them.
Great. So by way of education, what I thought we would first do is tell us a little bit about your education and what those letters mean after your name in terms of the scope of what you're able to talk about.
Yes. So basically, I am a registered dietitian, and my bachelor's degree is in clinical nutrition. And then I went to school for my master's in nutrition and applied physiology, or exercise physiology. So I'm able to do exercise prescription. I'm able to do medical nutrition therapy. And then I became a certified diabetes educator. And so I'm also able to give people guidance on caring for their diabetes.
And, one of the things, and we're going to dive into it because you talk about metrics. And I love the way that you talk about both metrics and intuition and like kind of how we put all of this together. So you guys are in for a treat in terms of the tips that are coming up. But before we do that, I like to start with what I've termed the lexicon of better nutrition. So there's a lot of confusing information out there today about diabetes versus pre-diabetes, and about what numbers you should look at, and even really things such as like glucose and insulin. So I know we don't have 45 minutes just to unpack what diabetes is, but for people who are maybe wondering about it, because we're going to dive into how exercise and movement and activity impacts your blood sugar, help us understand a little bit, some of those terms. Your hemoglobin A1C is a metric that you look at, and kind of what an assessment looks like, and just the diabetes space.
Right. So I might not be very popular right now by saying this, but if you're diagnosed with pre-diabetes, you actually have the beginning stages of diabetes. There's nothing about pre-diabetes. Okay, I'm glad you're clapping. And it kind of hurts my heart when people say, you know, I have a little sugar in my blood, or I have pre-diabetes and my doctor said I don't need to worry about it. And that's not true, because if we can basically capture this moment in time right now and make changes, improve your eating habits, and get you just moving, you know, stretching, yoga, you know, just walking a little bit, we can actually really kind of change what's going on and really kind of prevent your body from becoming that full-blown diabetes. So when you have pre-diabetes or diabetes, adults are really diagnosed with that A1C test. And what it's measuring is how much sugar is attached to that red blood cell. So the red blood cell is exposed to your environment, your blood, and little pieces of sugar get attached to it. And your red blood cells are a really great way to check it because they live for 3 months. So if you have normal blood, in terms of like you don't have sickle cell anemia or other red blood cell illnesses, then we measure you against this algorithm. And the amount of sugar that's attached to your blood will give you an idea whether you have normal blood sugar levels, whether you have pre-diabetes, which is 5.4 to 5.7, or if you're above and you fall into having diabetes.
Mm. And so, you know, another number I've been fascinated with that I think is really misunderstood, I guess 2 of them together, but as it relates to diabetes, would be your triglycerides. So let's talk a little bit about that. Is that something that you look at when you're looking at different measurements, and what does that tell someone? Because too often I think it gets lopped over into the cholesterol messaging.
Yeah. So if you have a lot of circulating sugars in your blood, your body will convert those into triglycerides. It has a really hard time dealing with that really high levels of sugar because it can be toxic. So it'll flip them into, well, not flip, your body kind of flips. It'll flip them into circulating fat, into triglycerides. So people who have diabetes also tend to have elevated triglyceride levels. The other reason, when people have diabetes, they're at greater risk of having issues with lipids and triglycerides and LDLs, because that whole metabolic pathway is not working properly. And with diabetes, one of the defects, and there are many of them, but one of the defects is that turnover of fat cells is really commonly occurring. So your body is not really, it's great at pulling the fat in, but then it's flipping it over all the time. Mm-hmm. So what you're seeing is elevated LDLs, you're seeing elevated triglycerides, and lower HDLs. And H, I always say, think of H as the healthy ones. Mm-hmm. So you want your body, and L is the lethal ones. Mm-hmm. So you want your body to be able to put the fat and the cholesterol and the protein where it belongs, but with diabetes, it doesn't always stay where it's supposed to be.
I think that's so important, because what we'll understand is that, you know, just focusing on sugar as it relates to diabetes, you know, is such a myth. So I think on that piece. So one of the things that you suggested, and, you know, welcome, first of all, to any of the practitioners that are joining us. It's so awesome when we get, as practitioners, to then hear from an expert in their field. Just, I think, lights us up in terms of what we can be talking about. And so one of the resources you recommended is called the Art and Science of Diabetes, right? And and I think that was really interesting where you point out there's this notion of art and science. So talk a little bit about how there's the science side, but then there's the art. I think that's what I was alluding to in the conversation around science research and how we practice, right?
Right. And that's really, really important, especially, we as human beings are not test tubes. So you can't just add the same thing for everybody and expect the same things to happen. And then when you add, we all have slightly different biochemistry. That's why some people are allergic to things and other people aren't. And some medications work better on other people. And some people are low in vitamin D and other people aren't. So with diabetes, it's a similar thing because we all are individual. There are certain things that are the same, like, people with diabetes struggle with metabolism of carbohydrates. Mm-hmm. So basically, we all need, if you have diabetes, we need to lower our carbohydrates. Mm-hmm. If you have type 1 diabetes, you just need to cover those carbohydrates that you have. And I used to say to my patients, there's only two things you can't eat if you have type 1 diabetes. You can't eat poison and you can't eat food with poison. Mm. But other than that, if you bolus properly, mm-hmm. you can eat whatever you want. And some people who have type 1 diabetes choose to eat very low carbs, and that's how they manage their diabetes, and they're perfectly happy, and they take insulin to cover the carbs when they consume them. Whereas other people want to eat a higher level of carbohydrates, and there's really no one way to do it. And that's really where the art of it comes in. As I said, the science of it is that with type 2 diabetes, the body cannot manage the sugars that they're handed. With type 1, people don't make insulin anymore, and they can't handle it. They need to take insulin. People with type 2 diabetes also may need to take insulin, but there are a lot of oral agents that they can use. Mm-hmm. So the science is there, but then the art comes in terms of how you want to manage your diabetes and how you want to treat your diabetes. And one thing I always tell people is, you're not a diabetic. You are somebody who has diabetes. I am somebody who has red hair. Mm-hmm. I mean, now I pay for it, but I was born with red hair. So that's what it is. I have red hair. You have diabetes. You are not a diabetic. That's not what defines you.
Mm. And that, I think, is critical because in the name of lowering carbohydrate, I know, this happens across the board, but so many poor dietary choices. And as we're getting into also on the fitness side. So one of the things, and I'm curious about, and I'd love to go into like what the app is and sort of understand that piece, because one of the things I think it's so important is a lot of times people will hear a low carb recommendation, but not be told, we're still in this like old era of looking at carbohydrates that you consume in totality in the day, as opposed to how often are you having carbohydrate, right? So, somebody might still decide to have 30 or 45 grams of carbohydrate at one meal instead of splitting it out. And, it tends to be, right, that if you split it out, your body can handle a little bit of it, more often. So tell me about, from a monitoring standpoint, how does the glucose, so I should start with LaurieAnn works for Glucosone. That was how I actually found her. And I just love what they were doing, and I loved that they're working with her on this part. So take us through a little bit about Glucosone and what you're doing there.
So this is really exciting because I found out about Glucosone through a friend of mine who volunteers at JDRF, which is the Juvenile Diabetes Research Foundation. And so as an exercise physiologist and diabetes educator and registered dietitian, she said, she knows this amazing person who came up with this brilliant idea on how to help people exercise with type 1 diabetes, and how they can use exercise for helping manage type 2 diabetes. Mm-hmm. And I was over the moon. Mm-hmm. And so when I met Charlie O'Connell, our CEO and founder, I was just I was like, this is me. I want to be involved in this, and I really want to help you change the world and really carry this message. So what our app does, and it's an app, so it's either on your phone or it is on the computer. And what it does is it provides the guidance for you so that as you can use physical activity for diabetes management. And exercise, we always say exercise is medicine. Exercise, we know that in cardiac rehab, we use exercise to help people get better. Well, you know what? we can do the same thing with type 2 diabetes as well. So with the app, you put in information about yourself, you put the medications you're on, you put, any if you need chair-based. There are a lot of people who suffer from diabetic neuropathy, or maybe they haven't exercised for a while, or maybe their body weight is such that they don't feel comfortable standing for long periods of time. So we have a entire library of chair-based activities that you can do, and you can use this exercise to help lower your A1C and help you lose weight. So you can do chair-based, you can do standing, and you can mix them up, and it is amazing. We hear such testimonials from people that they found our app and they're using it, and they are lowering their A1C, and they're losing weight, and they're feeling great. And the best thing about it as an exercise physiologist is they're having fun, because they could do an activity that's 12 minutes, or they could do something that's 37 minutes, and we require them to check their blood sugar. So when they check their blood sugar, the app will then tell them what is the best activity for them to do at that time in that moment. And then they're cued to check their blood sugar again after 25 or 30 minutes. If the exercise session goes longer, if it's a 12-minute session, then they just check in the beginning and check in the end. And what we see that narrowing of their blood sugars occurs, and they stay in the zone, which is 100 to 154 milligrams per deciliter. And that will give them an A1C of 7.0 or less. And that's really where we find, in terms of the complications of diabetes, in terms of eye damage, neuropathies of the feet, and issues with the kidney, at 7 and below, you see many less complications.
And, some practitioners might say, I've heard the number 80 to 120. So is the number 100 to 150 more specific to, hey, if somebody has elevated blood sugar, we're looking to bring it down? Or is it more related to when you're working out, your blood sugar is likely to be higher?
Right. So that's, again, where the art comes in. Depending on your medication, your doctor or your diabetes educator will tell you where your blood sugars need to be. Now, if you're on a hypoglycemic agent, something that's going to that works by lowering your blood sugar, like a sulfonylurea, like a glimepiride or glyburide or insulin or other medication, the meglitinides, that have the effect of possibly lowering your blood sugar levels in the moment when you take the medication or a little bit afterwards, then we want you to exercise at 100 or above. Okay. If you're below the 100, then chances of an activity causing your blood sugars to go too low and you being in a danger zone, going hypoglycemic, is greater. So if you're on any of those hypoglycemic agents, or including insulin, then you want to start your exercise at 100 or above.
Right. So Sandy, actually, when I said I was having you on here, she's on the West Coast and is at work, and she can't get off, but she wanted me to ask this question. So she's confused about when is the better time to exercise, and if she should eat before exercising. And so it sounds to me right off the bat that this is something that the app handles and allows people to personalize. But if we can kind of understand, if you have any general recommendations, that would be great to help her feel like she's got those pieces. And I should point out, that's also a great way, Sandy, and for those of you that are like Sandy wondering, make sure that you look in the description, because there is an offer for 1 free month or 50% off the app. We give you both options on there, so you can go ahead and sign up.
That's awesome. And that's a really great question. And thank you, Ashley, for setting me up to answer this so well. So in terms of when is the best time, it is kind of sort of dependent a little bit on your medications. So if you're on insulin and you just ate and you bolus, you take insulin to help lower your blood sugar, then exercising right then and there in the moment, especially if you're injecting your insulin in a muscle that's going to be working, might be dangerous. So that might cause your blood sugars to drop too much. If you have type 2 diabetes and you're on an oral hypoglycemic agent that is acting throughout the day, then exercising after a meal is actually a good thing to do, because it'll help. The exercise in and of itself helps your muscle cells take up sugars. So if you tend to have high levels after a meal, which is called postprandial, then exercising after a meal, if you're not on a hypoglycemic agent, will help your body lower its blood sugar. But remember, always, always, always check your blood sugar before you exercise. And we always recommend that you check it probably 20 to 25 minutes into this exercise session, so that you have a good idea of what trend your blood sugar is doing. And if you're on CGM, which is a continuous glucose monitor, you can, take a look. If you use finger sticks, then you just, check your blood sugar by, stopping what you're doing and just checking your blood sugar that way.
That's great. So we had another question, again, a pre-question. That's why I always love sharing who we're going to be talking with, because people throw in the questions and it helps me as an interviewer. So keep those questions coming, and check our calendar for who we're interviewing. So Jeff reached out, and he's diabetic, but he said he's sort of teetering between pre-diabetic and diabetic. Did not give me specific numbers or any more information. And, just a reminder for if you are just joining us at the very beginning, I was so glad that LaurieAnn made the comment that the distinction between prediabetes and diabetes is a pretty manufactured one in the medical community around numbers. We really are just talking about we need to be working with you and treating you at any of those stages. Jeff's question is, he really enjoys high intensity fitness, and he's struggling with what to have before the workouts, because if he doesn't have carbohydrates before the workout, he doesn't have a sustained energy during the workout. And he's tried, actually, he gave a couple of different examples. Like, he likes to have coffee, and then he had half a banana or half of an apple with some peanut butter an hour or two before the workout. And he was like, I was okay, but what he wanted to ask about were things like oatmeal and other carbohydrates. So I think the question is really, so that's very specific on Jeff. What I would love to get a little bit of a broader answer, because on these interviews, we cannot provide specific medical advice. So there would be way more questions that LaurieAnn would want to ask, and I don't want to put her in that position. But I do think that there's a challenge with not getting carbohydrates, and also the relationship between caffeine and your blood sugar. So I'd like to pull those two things apart and talk about carbohydrates, especially before maybe a more intense workout for a diabetic, and then also if there are any implications with caffeine and how it impacts your blood sugar before a workout.
Right. So I'll answer the caffeine one, because that's, that's easy right away. And caffeine does, in and of itself, caffeine will cause your blood sugars to go up. So people who have diabetes, if they drink coffee or they have something with caffeine in it, their blood sugars will go up. And and that's just going to cause it no matter, no matter what medication you're on. Mm-hmm. So what I would say in terms of eating food before, and it really is dependent again on your medication. So if you're going to be needing something to cover those carbohydrates, what I would say is probably carbohydrates right before you exercise is good, but keep them to a minimum amount. Keep them to 15 grams or less, and have something that clears your stomach quickly, and cover it with with what your medication is. If you're on a oral hypoglycemic agent or insulin, go by your doctor's guidelines. Mm-hmm. If you can plan and you can have a snack a little bit earlier, have a snack with a little staying power. So the person who called in actually referenced half a banana, which is about 15 grams of carbohydrates, and a little bit of peanut butter. Now, if I had that and then I did high intensity, I would probably, my stomach would hurt me, because it doesn't clear the fat so quickly. But if that works for you, again, it's the art and science of diabetes. So people, it works well for them. If you can pull it out a little bit further and maybe make sure that you have something that lasts a little bit longer, that works well. Some people are very sensitive to oatmeal, and some people find that oatmeal keeps them high for a long period of time. Mm-hmm. So I would say if that's the case, then you just, and you can check it with your blood sugar, checking your blood sugar, you can see. So, try to have something that is going to keep you in the proper blood sugar range that your doctor gives you.
Great. And I got another question, which is about after a workout. And I think many of us can relate to this. Just feeling starving after a workout. You worked out and, it could be I know you love dancing. It could be some great dancing, or you went for a hike and afterwards. And at that point, it being very hard to limit yourself. So can you make some recommendations for what you need, what's better for your blood sugar after a workout, as well as some ways to maybe address that post-workout hunger?
Yeah, so that's a really great question. And a lot of people, when I worked with kids, one of the best things that we used to say, like for them after they're, really, doing like playing soccer or, something that's, very active like hockey or something like that, we always said, give them like some chocolate milk, because chocolate milk has a little bit of sugar, especially if you dilute it, like some chocolate milk and some white milk. It has fat, so the recommendations is really to have a little bit of fat, even if it's 1%. Have 1% milk, and milk also has carbohydrates. So it's kind of like this nice little package of protein and carbohydrates and a little bit of fat that'll keep your blood sugar stable. After you exercise, a lot of times your stores of sugar, which they're stored as glycogen in your muscles, get depleted. So it's a good idea to have a snack afterwards that's going to satiate you. And if you just have, something like potato chips or crackers or just carbs because, you're just starving, you're going to keep on eating, because it's going to cause, especially if you have type 2 diabetes, it's going to cause your body to produce a lot of insulin. And insulin's a hunger hormone. So if your insulin levels are high, you're never going to be satiated. And that's why a lot of people with type 2 diabetes are hungry a lot, because in actuality, their insulin levels are high. And that's part of the whole defect for type 2 diabetes. So if you have something that has a little bit of carbohydrate, again, a little bit of protein and a little bit of fat, like maybe, again, maybe crackers and peanut butter, or half an apple and peanut butter, or my favorite, carrots and peanut butter, or, a handful of nuts, or maybe some cheese and an apple or something like that, or maybe even like half a sandwich, and then eat it slowly, enjoy it, relax. And then you can, see how hungry you are afterwards.
And I did have somebody, and everybody wants personalized information. So I like, all right, I'm not going to get you a personalized answer, but I responded and said I'd throw it out here because I think it brings up an intersection of a lot of trends. So she was asking me about, as a diabetic, she's really interested in putting on some muscle, and her friends go to a local CrossFit gym. So she was wondering, is CrossFit okay for diabetics? And then she followed up and said, should I be paleo or do keto? So I think what we're really seeing there is like all the trends that are hitting at once. And so I thought what I would just, kind of have you respond to is, because people are hearing about this, maybe are there any limitations for a diabetic? I love the way you said you're not actually a diabetic, you're a person with diabetes. So
exactly. Language, we find that language does matter. So it's always good for all of us as practitioners to refer to people as that.
Yes. Just to remember that our clients, so are there limitations on exercise choices? And then the second part to that is, are some of these very low carbohydrate diets, keto and paleo, a preferred option, especially with, I guess for her with CrossFit, she was asking. Yeah.
Yeah. So I understand, and I hear everybody, paleo or ketogenic, they're, and they've been around forever. My mom, who, if she was alive, she'd be in her 80s now. And, there was a time and space when it was popular then. So some people love it and it works really well for them. And there are a lot of people who have diabetes who follow a ketogenic or the paleo diet, especially with type 1, and have really great blood sugar control, and it works for them. So what I always tell people is try it and see how you feel. And always, check your blood sugars, make sure that that your health is not at risk, and see what works for you. For me, I don't know if I could do it. I also, have a history. I worked in eating disorders. And so I always like to make sure that people are doing it for the right reasons. Mm-hmm. So if you're doing it and you feel like, you're restricting your diet and it's stressing you out and it doesn't feel good, and you just feel that it's not really what's working for you, then you might need to, kind of sort out the reasons why you're doing it. But if it's something that you're doing and it works for you and you're happy and it doesn't interfere with your life and it's just a part of who you are and your blood sugar numbers are great, then try it. We're not test tubes. There's not one way for everyone to eat.
This is such a valuable, I'm so excited to share this message with so many people, especially, and I also just encourage those of you who are watching now, or if you're watching this later at a better time for you, share this with your practitioners, because I think that as much as I think we're more aware of one size fits all diets not working. I think we're a little bit off the mark on the fitness side. But what I also love, and the reason I want to have LaurieAnn on today, is this app allows you to actually test what's better for you. So at the Better Nutrition Program, we've developed tools created by practitioners. This one lops right in there. So I was, so thrilled to see that. Because what we really know is that when you assess where your body is right now, you can make the better recommendation and the better choice. So I'm just so thrilled to have had this opportunity to talk to you and to introduce everyone to Glucosone. Was there anything you wanted to leave us with? Otherwise, this is great.
Nope. I thank you for having me on, and I really look forward to seeing everyone in the Glucosone.
Great.